Okay, so today's exercise is looking again using the trigger point ball that we looked at yesterday, where we were using it yesterday for the glute, the hip muscles. Today we're going to look at how we can use it for the front of the chest. Again, just like one of the previous exercises, we tend to find that obviously at the moment we're spending a lot of time at desks, a lot of time at computers, and we tend to find that that brings us into this sort of really rounded position. And one of the consequences of that is we can get a little bit tight through the chest muscles, and that can contribute to neck or shoulder pain. So what we want to try and do is use a trigger point ball just to help release out through the chest muscle. Now, the way to do that is we're looking for the sort of almost the middle of the pec muscle, which is just inside of the shoulder. Okay, so what we're coming to is not the shoulder at the front, okay, not the middle of the kind of the chest bone, but somewhere in between. So around about here. And there's two ways of doing this. Okay, we can do it on the floor. We can sort of just lie down, kind of face down, or what we can do is position it, okay, against the wall. So obviously it's hard to do here on the video, so what we're going to do is just show you, we could just lean into the wall, okay, and then again, just like we did yesterday, all we're trying to do is make sure that we've got a consistent pressure on a tender spot. Hold that for sort of 30 seconds to 45 seconds until it reduces down by about 50%, and then hey presto, we should feel like actually that whole area just feels a little bit more free and easy. Now, we talked yesterday about when we're doing the glutes, maybe 3 or 4 different repetitions, 3 or 4 different spots. Here we're probably going to find maybe 2, so one maybe slightly more towards the head, maybe one slightly more towards the armpit. But what's important is you just have a little feel around and go, okay, yeah, that's a tender spot, and then just work on that. So just have some continuous pressure against that from the wall, and then once that's released down, once that's felt a little bit freer, okay, then we can repeat on a different spot. So like I said, maybe 2 or 3 spots maximum in this area, and obviously repeat that on both sides.